our awardees are going to come up in a couple of minutes. I'd like to turn the podium over to Ann Whitman from, as I said before, our board and from the Jonathan Cole Center. She is a leader in this Commonwealth in reminding all of us that this work is about the people we are here to serve. And she is a leader of a peer among peers, and I'm delighted to welcome her.
Good evening. It's a great honor to introduce Joan Taglieri and participate in her award presentation. I will let Danna Mauch talk about her many accomplishments over the past 35 years. But I want to speak a little about her involvement in the Metro Boston and Southeast Recovery Learning communities. When Howard Trackman and his team came to Boston Medical Center to ask Joan Taglieri and Peggy Johnson to host a peer-run resource center, they welcomed him with open arms. We knew they were serious when they gave us food at the meeting. They were champions and mentored us as we applied for grants for the Metro Boston and Southeast Recovery Learning communities. And Joan has continued to ensure that the decision-making for the recovery learning communities sits squarely with the peers. She participates in our meetings, is authentic and collegial, and encourages us to improve upon our ideas, an occasion to reach consensus. She dislikes being in the limelight, so I gotta call this award a growth experience for her. We make the decisions about concerning the recovery learning communities, unless, of course, we're about to run afoul of the law, or DMH regulations, or BMC regulations. And what would happen if we added Tufts to that? A lot of regulations. And we're very entrepreneurial, so this is quite a task. She's unflappable, excellent in a crisis, has great interpersonal skills, and is focused on the task at hand. For me, on a more personal level, she's created a work environment which is authentic and caring and focused on improving the lives of people in our system. And I gotta say, it's a space that's free of stigma, politics, and hidden agendas. The culture she fosters for all is filled with creativity and passion. Other staff members have commented she's a team player, but independent and able to be firm when necessary. Paul Drew and Jim Foley were people who cared deeply about individuals with lived experience. They were recovery-oriented, worked very collaboratively with others. They were movers and shakers with great vision, but very hands-on and believed in the power of community. Joan Taglieri embodies these traits of Paul Drew and Jim Foley, and I can't think of someone who deserves this award more. Thank you.
So Ann and I agreed to split this bill tonight, and it's my great pleasure to say a few words about a person I admire deeply and whose contributions to the Commonwealth are extraordinary, his friendship I value. I've been privileged to know and work with Joan for more than 30 years. I won't say how many more. From the very start of our work in the Department of Mental Health, and over the years in diverse efforts, such as facilitation of the development of community care systems, the phase down of public and private hospitals, the building of a collaboration between Boston Medical Center and the community as it was forming as an organization, and the departments and clients it would serve, in advocacy work for this association and on behalf of individuals in need, Joan's always impressed me with her deep knowledge, her abiding commitment, her quiet resolve, and her skillful handling of any matter. Whether tackling the positive tasks of bringing new and effective services and supports to people in need, including those recovery-oriented and peer-led programs that Ann was just talking about, or the thorny challenges of unmet needs in the face of too few dollars, too few staff, and things gone wrong, as they sometimes do in human enterprises. Joan is the person you want in charge. Her moral compass drives her to consider not only the ethics of care, but the ethics of the justice associated with care. She has the moral courage to find her way and help those of us around her find our way through very difficult situations and find in those fair resolutions for everyone. She's honest, as has been described, and open, and yet very confidential. She has a gift for listening carefully, something we heard about from our other awardees this evening, and she responds insightfully, whether it's on behalf of the people she serves or their family members or their caregivers, her colleagues, and her friends and family. Ann talked about Joan's authenticity and her respect for the values, experience, choices, and decisions of others. She has a gift for complementing her clear thinking with effective implementation. She leads by doing, without fuss and absent any expectation of recognition. So I'm especially pleased that we can recognize her tonight. And the memories of Paul Drew and Jim Foley are honored by her selection. Paul considered Joan the most competent and extraordinary of clinical administrators and a personal touchstone. And Jim, the trusted advisor, trusted Joan to advise him. I'm sure they're toasting her from their current location. Her devotion to those she serves, to her colleagues, to her friends, and her family is legendary. And I know that Michael, her son, who's with us tonight, and Joe, Jenna, her sister and parents can attest to this, as can so many of you in this room. We have all been touched by her wisdom and kindness. Joan is one of those people that you want on board if you ever find yourself in a lifeboat. She is steady, strong, and knows how to row as part of a team. She has a quiet temperament and an abiding ability to convey hope. And if the proverbial weather gets stormy or the boat gets leaky, I trust you will apply her extraordinary judgment and implementation skills to helping us all get through. So I hope, Joan, you'll join us here on the podium now, and our friend Patty. Patty,
The Drew-Foley Award to Joan Taglieri in recognition and appreciation for your personal and professional commitment to the provision of quality and affordable behavioral health services to children, adults, families of the Commonwealth, and to the advancement of respect, dignity, and independence for all citizens of the Commonwealth with behavioral health needs. Congratulations.
So thank you, Ann and Donna, for these kind words and for all your support and guidance over the years. Truly appreciate it. And thank you to Bernie and Tim and to the MAMH board as well. I've grown older with many people in this room. I wish Jim Foley and Paul Drew were still here with us. They were both very good men, committed to their work. Mental health, genuine, caring, always ready to help, great colleagues. I'm honored to receive an award in their name. I think that in mental health and in healthcare in general, we're only as good as our partnerships with the people we serve and our partnerships with colleagues. This is not a solo gig. So it is clear to me that while I have always tried to give my best in my work, the work I do and what I accomplish is most greatly impacted by those around me in my day-to-day work life. Whether celebrating successes in our work or handling the tragedies that befall the people we serve, the people we work with, or the tragedies in our communities. It is the working together that makes the tragedies bearable and the successes most meaningful. So it's with these thoughts that I thank all of you who have had the opportunity over these many years to work with. I appreciate your support, your contribution to my growth and enrichment of my work life and life experience in general. I want to especially thank and give gratitude to my colleagues at the Boston Medical Center Department of Psychiatry. And to the recovering learning communities, of which I'm proud to be a part of. And to all my colleagues in the Department of Mental Health as well. So I appreciate all that have contributed to me, to my career, and enabled me to do my part. I also, while I'm up here, want to give a real shout out to both Bernie Carey and Tim O'Leary for what I think is probably thousands of acts of kindness that those two men have shown.